I'm Dr. Jane Simington. I'm speaking to you about complementary and alternate methods of healing. How I got involved in using them and how I use them today in my private practice. I began my nursing career with a 3-year diploma from a hospital school. I remember standing on the stage at my graduation day. Even though I had just won the theory prize for the highest marks in the province, I thought, this was nice, and I learned a lot. But I thought that I was going to learn how to heal people, and I didn't learn that. So I practiced for a number of years as a diploma nurse. And then I registered to take my degree in psychology because I thought, well, maybe that's how I learned to heal people. I was nearly completing that degree when I read an article in the Canadian Nurse talking about Dolores Krieger's methods of using therapeutic touch. And while I continued with my degree in psychology, I instantly also registered to do my baccalaureate in nursing. And so I attended the University of Saskatchewan, and every paper that I could possibly work in concepts of holistic health, I chose to add that to my papers. I became very interested in therapeutic touch and read all of the literature that was beginning to move into the academic world around Krieger's work and the research that was being done on therapeutic touch. I registered to take a course in therapeutic touch and did all of the levels, and then began to actually teach a few people about the uses of energy and using therapeutic touch to heal. I was nearly complete my baccalaureate degree when my son was killed. And I began to almost immediately use therapeutic touch to heal myself. I would use it on my face, I would use it to help me sleep, but mostly it would clean my aura and my energy field. I enrolled in the master's program in nursing, also at the University of Saskatchewan. And I was the first person in Canada to actually do research using therapeutic touch. The paper that I published, Therapeutic Touch, Reducing Anxiety in Institutionalized Older People, is the most cited nursing paper. And so already then, people were beginning to understand that we needed to look a little bit differently at what we're actually doing in nursing and beginning concepts of healing as versus just helping were beginning to really grow in the minds of people. I went on to do my doctorate in Hawaii, and because I was very aware that there was a spiritual component to energy healing work. And I studied many alternate methods as I was doing my doctorate, but became really focused on the use of Reiki. And it was a nice complement for what I already knew about therapeutic touch. So when I came back to Alberta to teach at the university, I carried with me this incredible understanding of how the healers in Hawaii used energy healing as a basis for all the work that they did. And as I started working at the faculty level, academic level at the University of Alberta, I began to realize that I needed to somehow find a way to bring these concepts into my real world, into my academic world, and into the world that I lived as personally and professionally. So I started opening a private practice. I was recognized as registered as a grief counselor, and so I started working with grief and taught all of the people that were grieving how to smooth and clean their aura because I now know and believe, and it worked so well for myself, that we need to cleanse the aura from all the sadness that we're feeling, just like we need to find a way to remove the grief and sadness from every cell of our body. Very shortly after I became faculty at the University of Alberta, Faculty of Nursing, the women's prison in Edmonton was opening up, and they were looking for somebody to do individual and group work in trauma and grief with the women at the prison. I started working there and soon realized that those women were hungry for other methods of healing than just cognitive or talk therapies. So I began to teach them therapeutic touch and Reiki, and I taught the staff at the prison the same techniques. That was about 10 years ago, and my life has moved now in quite a different direction. For about 10 years, I have owned Taking Flight International Corporation. In my life now, the main work that I do is teaching other professionals grief and trauma therapy. And so in the grief support work that I do, I teach therapists how to use therapeutic touch and other forms of energy work, not only to help with the grief, but also as a way to support the dying person. And thirdly, as a way to help the caregiver. In the trauma certification program that I teach the therapists many ways to use energy work to help those that they're working with stay grounded, again to cleanse and seal their aura. We use an energy method to remove flashbacks. And so I've combined the therapeutic touch and the Reiki with different techniques that I have learned, one of them being neuro-linguistic programming. But the students who take this training learn that energy is all around us, and energy is a very important part of us, and that we need to more fully understand that concept as we help people heal. And as you're helping people using complementary and alternate methods of healing, that's a very important part, is to understand that that energy is us. It moves through us, and we need to keep it balanced. In my second book, Setting the Captive Free, I speak a lot about how we as helpers need to be so much more connected to the energy that is all around us. I talk in this book about the energy centers, about the aura, about the meridians, and give many skills for people to use in both their personal and their professional life to help them in healing. So in answer to how do I use complementary and alternate methods of healing in my practice today, it's a part of my life. Everything that I do is based on an understanding of energy. When I'm in relationship with people, I automatically get a sense of what that energy is like. While I no longer teach Reiki and therapeutic touch, I did that for a number of years as a course, as courses for both lay people and professionals. I now incorporate it into every workshop that I give, every training that I give. A good example of that is several weeks ago, I did team building with a group of managers. I taught them the power of cleaning their aura to prevent them from being so vicariously traumatized by the stories that they were hearing and by the jobs that they had to do. So for me, using therapeutic touch, using Reiki is something I do for myself every single day. I meditate every morning, and I incorporate it into every aspect of life.